I believe that every single thing that is known about a drug, good and bad, should be available to everyone who is considering using that drug.
One person Shulgin thought should try MDMA was his friend Leo Zeff. Zeff was one of the leaders in an underground community of psychotherapists that was treating patients with LSD and other psychedelic drugs.
Leo thought MDMA was absolutely outstanding, just almost unbelievable. He went on a campaign and introduced MDMA to therapists all over the country and even going to Europe. He told me that he'd introduced about 150 therapists to MDMA and how to use it properly.
Dr. Leo Zeff, he introduced me to it, and I was immediately impressed, as he was and many others were, by its usefulness. The very fact that it doesn't change ordinary perception very much, but changes the feeling tone, the feeling quality, and reduces fear, thereby allowing you to look at, in a kind of impartial way, things that are normally just too anxiety-provoking to look at.
In 1983, Kathy Tam was raped and tortured in a park in Northern California. Her attacker was never caught.
I just felt broken into just 1,000 pieces. I felt like shattered glass. It was very difficult to carry on in a normal way because I was afraid of my own shadow. Everything frightened me.
What I was thinking was that I didn't have my wife with me. I was worried that we were going to lose her forever, that she was not going to come back to normal. It was a pretty scary time. We had 2 little kids. She was not functioning on a normal basis.
I had been in therapy and had been blocked by how much I didn't remember. I mean, I had a lot of support from my husband and friends and in therapy, but I needed something more.
A friend referred Kathy Tam to a psychotherapist who was giving MDMA to patients suffering from post-traumatic stress disorder.
By taking the MDMA, it's like my mind allowed me to grapple with and remember the pieces that I couldn't or wouldn't allow myself to remember.
Over a period of time, she was able to get back in touch with the kids and be with them and be a loving mother again. I'm certain that wouldn't have happened without the MDMA.
Without that, I can't tell you where I'd be. I'd probably still be back there, hiding out in my house.
The people who were traumatized, could look at the situation that traumatized them, like the woman who was raped or assaulted, could look at the situation and surround the whole memory of it with this sort of empathic frame that allowed her then to lower the defenses and allowed her to see exactly what had happened, which had been blocked.
By the late 1970s, the circle of people who had tried Alexander Shulgin's compound was growing. Word about MDMA had spread well beyond the psychotherapy community.
When I first heard about the wide popular usage of MDMA under the name of ecstasy, I was quite saddened, because I was convinced from what I had seen that it was going to could have a marvelous role in medical use. And this broadcast popular usage would inevitably lead to its removal from availability. And indeed, that is what did happen.